It is not just adults affected by the Omicron surge. Some states are seeing a dramatic increase in children being hospitalized from COVID. While that's not the case for Middle Tennessee, cases are rising and pediatricians are watching the trend closely. Here's News 2's Mary Mays with their urgent message for parents.
Pediatric cases of COVID-19 are on the rise in Middle Tennessee, but hospitalizations aren't.
The good thing is that most of the kids who come in really are either asymptomatic or have really mild symptoms.
Unfortunately, pediatrician Dr. Joseph Gigante fears that won't last long, as trends in larger cities typically indicate what's to come.
New York, in Pennsylvania, and in Texas, where they've actually seen a dramatic jump in the number of children who've been hospitalized. I think nationwide, the number of kids who've been hospitalized has increased over 30% over the past week or so.
Dr. Gigante explains there are contributing health factors that put certain children at a higher risk.
The majority of kids that we do see coming in have underlying medical conditions. And it's interesting, obesity falls into that category.
And while the percentage of children requiring hospitalizing is still lower than adults, he says for those who are affected, it can be life-changing.
Well, I can play the odds and think that my child's going to do fine and just have cold-like symptoms, but you don't want to be that unlucky parent and that unlucky child who ends up getting so sick that they need to either be put on a ventilator or end up with this multi-system inflammatory syndrome. So my response is, why take a chance? We have vaccines, they're available, they're safe, they're effective.
Dr. Gigante urges parents to get their children vaccinated now so their bodies start building immunity as soon as possible. Mary Mays, News 2.
And right now, children 5 and older are eligible for the vaccine. Dr. Anthony Fauci said today children younger than 5 may have to wait a little longer before a vaccine is available for that age group.